So hello everyone, let us today discuss regarding the case presentation, case study, and you can also prepare a nursing care plan from this on the CSOM. This is the classification of otitis media, that is chronic suppurative otitis media. So let us start with the introduction first. Firstly, we have to introduce the topic, to introduce the self, introduce the patient, his or her chief complaints, and diagnosed that upon various investigation and laboratory procedures, what he or she has been diagnosed with. Then you have to write the patient profile, which include the following data. And if the patient has undergone any surgical procedure, you have to mention that procedure, the name of that procedure. After that, followed by this, you have to mention the chief complaints, which includes the following. Here, it's come to present medical history of the patient. And while you are assessing the patient, examining the patient, what are the present medical history? Past medical history due to which patient has been diagnosed hospitalized in the hospital in the past. Present surgical history, what is the present surgical procedure done on the patient. Past surgical history, if patient has undergone any surgical history in the past, you have to mention here, along with the year, in which year and from which hospital. Family history, here you have to prepare a family chart, family tree, which includes here a square. Here the square symbol represent a male, while the circle symbol represent the female, and you have to shadow, see like this, you have to shadow that who is the patient is. Along with, you have to write their name, each and every family member, along with their age and gender, and what is the relation of that person to the patient. Then prepare a family chart, socioeconomic status, and personal habits. After the personal habits, you have to write the physical assessment, which include general examination, mental status, and anthropometric assessment. So in the anthropometric assessment, you have to mention the height, the weight of the patient, and you have to calculate the BMI of the patient and classify that if the patient has underweight, normal, and comes under the obese or overweight category. Then the medication that currently patient has been administered, what are the medicines that has been administered to the patient, you have to mention them along with their route, frequency, doses, action, side effect, and nursing responsibilities. Then you have to write the vital signs of the 3-day and remark them. The lab investigation, along with their remark if they are normal, increased or decreased, and head to toe examination, which includes skin, head, face, eyes, ear, mouth, nose, chest, abdomen, extremities, genitalia and rectum, and at the last you have to mention the mental status and mental examination, neurological examination, sorry. After that, you have to describe the assessment part. You have to describe and define the diagnosed disease condition of the patient. So here it is CSOM, that is a category of otitis media. So we will start with the otitis media, the introduction of otitis media, the classification of otitis media, and Then you have to define each category of the otitis media. Try to prepare a good image and diagram that I will show you later. And here it comes the third type is chronic suppurative otitis media, that is the diagnosed of our patient. Here I have prepared a diagram for otitis media along with the labeling. Then etiological factors, what are mentioned in the books and what are present in the patient. The clinical manifestations, that what are described in the book and what are present in the patient. Pathophysiology. Here is the tympanic membrane perforation leads to chronic inflammatory mediators activation that result in weakening of tympanic membrane, that result in mucosal edema in the ear, leads to mucosal ulceration and breakdown of epithelial lining and formation of polyps within the middle ear space. And that all these factors pathophysiology lead to otitis media in the middle ear. Then you have to mention the diagnostic evaluation, what I mentioned in the book and what are done in the patient. And at the last you have to mention surgical and medical management along with the complication of after procedure complication or complication of disease condition. So now, as a part of NCP and nursing care plan, you have to write 5 nursing diagnose regarding depending on the patient condition and diagnose. So here are the various nursing diagnose on the otitis media and regarding on the data dependent on the condition of the patient. Then you have to prepare a nursing care plan on any of the 3 nursing diagnoses, which includes nursing diagnosis, assessment, nursing diagnosis, goal, planning, implementation, rational, and evaluation. So for the last part, you have to prepare a progress report of all the days, maximum 3 days, that when you have in which you have been provided care to the patient. You have to mention here what care is provided to the patient by you to improve the condition of the patient. Then it's come to health education that is provided to the patient and the family of the patient. This is upon diet, prevention, medication, positioning, education, and follow-up. And at the last, you have to summarize the whole case study or case presentation in the short. So here is the summarization. So that's all about the otitis media and types. Thank you.